Next on our agenda is Dr. Mark Manning. Dr. Manning is an assistant professor at Wayne State University School of Medicine. Dr. Manning's research programs focus on understanding the dispositional and situational factors that contribute to racial differences and disparities in secondary cancer prevention behavior, and on using this knowledge to reduce racial health disparities via theory-guided interventions. He uses well-validated social psychological theories to examine the unique and combined influences of perceptions related to the behaviors, such as behavioral beliefs, attitudes, and normative perceptions related to racial group membership, like racial identity, discrimination, and group-based medical mistrust, and relevant knowledge and beliefs, such as perceptions of personal cancer risk or cancer risk knowledge, on individuals' cancer prevention behaviors in particular contexts. Dr. Manning?
Okay, so I am going to talk about the effects of COVID-19 on racism and distress. And my sample, the sample that I use for these data differ from the ones that Dr. Schwartz and Dr. Thompson presented, because it's a small sample. It's a very specialized sample looking at people who were in a study that I was in which I was testing an intervention to increase colorectal cancer screening. So all of these individuals were overdue for screening. They were all African-American. And they all had to report that they had a primary care physician. So Carrie, if we could go to the next slide. I want to address this problem directly. The study was meant to address this problem, looking at the higher incidence and mortality compared to the general population among African Americans when it comes to colorectal cancer screening. And one of the contributors to that is reported lower screening rates among African Americans compared to the general population. So if you go to the next slide. So the study, we recruited participants in line. They all had to be colorectal cancer screening eligible. So they were all over 45, had a primary care in case we found any positive findings, and had to be overdue for screening. And if you look down, we ended up with 269 who were able to complete the survey for whom we could analyze their data. So we tried to recontact those 269. And if you go to the next slide. So in that first study, we got measures of racial identity, and we used a multidimensional inventory of Black identity for this, the centrality subscale, and just to show that we had a pretty good distribution for reports of racial identity. And that's basically how central is being Black to who you are, roughly. So we also got on that initial study, measures of group-based medical suspicion. It's a part of the group-based medical mistrust scale, and it's the extent to which you should be suspicious of the medical institution because of your race. We also got measures of racism using the racism in life event scale, and we got a pretty good distribution for both of these. And this is just measuring the extent to which racism has been attributed, which you attribute racism to different things in your life, like employment, health insurance, and things along those lines. So if we go, okay, now hold it here for 1 second. If this study ended in March of 2020, which is right when everything else started up. So that study ended, I was looking at my data, and then suddenly the United States had COVID and we started shutting down. And then there were another couple impactful events related to, then also April and May, we started to see those racial disparities in COVID incidence and hospitalization and mortality that we're all pretty familiar with right now. So one click. Also around that time, we started to see all the incidents that Haley referred to with regards to African Americans and police violence and death, and people being much more willing to get out there and say, hey, make more noise about this, frankly, than I've seen in years. And then one more, and that is coincident with the rise that we saw in armed white nationalism. So one click. This is going to be pretty distressful when you put it all together for the average African American. I was interested in the extent to which perceived mistrust and perceived racism increased because of everything that had been happening since March in 2020. And I had a sample that I could conveniently look at that with. And I was also interested in the extent to which that increase in mistrust and increase in racism would lead to distress, and then long-term would lead to decreased preventive health behaviors. That decreased preventive health piece is in gray because I didn't get all the way to measuring that. I just was able to measure up to distress. So These are some exploratory hypotheses that I was looking at with these data, that perceived racism and medical suspicion would increase following those racialized events. Those increases in racism and suspicion would be buffered by racial identity and emotional support. And then racism and suspicion and the increases in racism and suspicion would lead to distress. And that relationship between racism, suspicion, and distress would be further buffered by racial identity and perceived emotional support. We recontacted those participants between June and July, and we got a sample of 82 that we could work with when we filtered up responses that were suspect. And we remeasured racism, we remeasured group-based medical mistrust, that suspicion subscale, and then we looked at some COVID-related experience that we're not going to get into. But then we also measured emotional support, we measured general depression, anxiety, and stress, and then we also measured event-related stress related to COVID and related to racist incidents. This is the promised measure that we use for emotional support, and one more click forward. And you can see that we had relatively good distribution, but everyone, for the most part, reported feeling emotional support, reported relatively high emotional support given the range of that scale. And next, so now we look at the relationship between racial identity, emotional support, and how that impacted the extent to which racism changed, perceived racism changed before and after COVID. So hit it once. This is a baseline model, and it's just showing that in general, according to this model, there was no change on average in racism from pre to post-COVID, in perceived racism from pre to post-COVID. But it's also showing that there's significant variation in the extent to which there was change. So in other words, that mean for change is 0, but there's variation around that mean. So next slide. No, next click. There we go. And if you look at the extent to which racial identity moderated the change in perceived racism from before and after COVID started, African Americans who identified more highly with their racial group perceived more racism, and perceptions of racism increased. And then one more. For emotional support, African Americans who perceived more emotional support had lower perceived racism on average, and emotional support didn't affect the way that racism changed pre to post COVID. And the same model looking at group-based suspicion, hit it once, we see that there was significant increase in group-based suspicion over time from before COVID to after COVID. And there was, again, significant variation in that change. So one time, for African Americans who had higher racial identity, it appeared that before the COVID, so at that first time point in measurement, racial identity might have buffered group-based suspicion. But then for African Americans who were higher in racial identity, that changed much more over time. So they would become more suspicious after the COVID events. And one more time. And similarly, African Americans who perceived more emotional support had lower group-based suspicion, but then also group-based suspicion had no effect on change. Emotional support rather had no effect on change in group-based suspicion, which is similar to what we saw with racism. So this is the measure that we used to look at depression, anxiety, and stress. It's the depression, anxiety, and stress scale. And if you just hit it 3 times, Kerry, just so you can see that the means were relatively low. So the scores ranged the entire range of the scale, but this is showing that for the most part, there weren't high levels of depression, anxiety, and stress. And these are just general. So like report on how you've been feeling over the past week. We're not pegging this to any particular event. So this is the stress that is explicitly related to COVID, and it's similar to the measure that Haley showed with regards to the impact of events scale. And it's just saying during the past 7 days with respect to COVID, how much you've been feeling, and then these thing like I felt irritable or angry, I'd have trouble staying asleep, things along those lines. And again, not high levels of distress related to COVID, but it does range the entire range of the scale. This is the exact measure that Haley used to look at distress that's specifically related to racism. So specifically related to those highly publicized racist events that were happening around the time when these individuals were taking the survey in like June and July. And again, you'll see it ranges the full scale. It's not particularly high, but these are higher. These means are higher than the means for the distress specifically related to COVID. And just to like look at all of those, summarizing again, levels of distress were not particularly high, but it did range the full range of the scale. So there were African Americans in the sample who were experiencing a lot of distress. And then when we looked at the relationship between distress and emotional support, the more support you had, the less distressed you were, like pretty much across the board. When you looked at the relationship between racial identity and distress, the stronger you identified as an African American, the more distressed you were with relation to COVID and with relation to the racialized offense, but not with regards to general distress, which makes sense. So if you remember, this is what I was interested in understanding, that whether or not the increases in racism and mistrust would lead to distress and that would have any impact on behavior in the long run. And one time, also looked at the extent to which racial identity and emotional support might buffer the relationship between the increased racism and mistrust and distress. This is the model I used. I'm going to skip talking about this model and just get right to the results. So if you hit it once, Carrie. So the model had basically a two-way interaction in it. We're looking at an interaction between racial identity and emotional support on the relationship between racism and those three measures of stress, or group-based suspicion and those three measures of stress. So when we look at racism as a predictor, for African Americans who perceive less emotional support, average levels of racism was significantly associated with greater distress, but not among those who had more emotional support. And there was no effect of the change in racism. So whether or not racism increased or decreased or stayed the same for you as a person, it didn't have an impact on your distress. And then next, when we look at the relationship between group-based suspicion and distress, African Americans who perceived less emotional support and for whom group-based suspicion increased more over time from pre to post COVID, they reported higher distress. And for those who, if they had lower perceived emotional support, if they had higher emotional support, those relationships were there. What we did see was just one instance where for distress that was associated with racism and those racist incidents, when perceived emotional support was higher, group-based discrimination, group-based suspicion, and racial identity were associated with that racism-related distress. So if we go to the next slide, let me finish it. So there's no moderating effects of racial identity. So the moderating effects that I just talked about had to do with perceptions of emotional support. Racial identity did not moderate the effects of racism on distress or the effects of suspicion on distress. So in general, one click, generally speaking, emotional support buffered, but racial identity did not buffer the effects of racism and mistrust on different domains of distress. So general distress, and then distress specifically related to COVID and distress related to the racist incidents. So I did on this survey ask some questions about intentions to continue different cancer screenings. These are incredibly exploratory because the sample sizes ended up being so low. When we looked at mammogram and pap smear, it happened that we had more women in the sample. I think there were about 70% women compared to 30% men. So we looked at the relationship between these different measures of distress and intentions to engage in these different screenings. And what's interesting here is I saw a positive association between these measures of distress and intentions to engage in mammograms and intentions to engage in pap screening. And This is counterintuitive because I would have thought that we would have seen lower intentions that were associated with distress. This is also interesting because, like, typically when you look at this kind of research looking at the relationship between stress and some cancer related outcomes, the stress that we're looking at is stress that is related to cancer, like cancer worry or cancer distress. So it's interesting that these measures of stress and distress and anxiety and worry that are not related to cancer have these relationships with intentions to engage in preventive behavior. So for the next steps, what I'd love to do with moving forward with these results is examine how perceived racism, suspicion, and distress continue to evolve. COVID is still happening, events are still happening, racism is still happening. So how are these perceptions evolving as we all collectively deal with everything that we're dealing with right now? Then I want to examine the associations between the effects of racism and suspicion and distress. And it would be great to have an intervention that deals specifically with race-based distress, but not race-based trauma. Rather, this persistent distress that is kind of unyielding and related to dealing with the status quo of racism in this country. And then there's a lot of media that suggests that African Americans will need relatively more mental health services after COVID. I'm wondering how true that is compared to the general need for mental health services that African Americans face right now. And then we need a greater understanding of the relationship between distress and preventive health behaviors, because those associations that seem pretty intuitive, I think they need to be scrutinized more. And so I'm going to stop here.